Yesterday, the Food and Drug Administration has limited the use of the Johnson & Johnson COVID-19 vaccine for the adult population. Here is Health Minister Dr. Frank Anthony explaining the reason for this decision.
The FDA issued a new recommendation that they would limit the use of the Johnson & Johnson vaccine in adults, and that's because they have noticed that with J&J that they had a number of cases of clotting. This was first detected in 2021, and because of that, in April of 2021, they had put a pause to the use of J&J vaccines. That was subsequently lifted after 10 days, and they continue to advise that people can use the J&J vaccine. And then they constituted an independent panel, which then reported in December of 2021. And the recommendation from that independent panel is that people should use more of the mRNA vaccines versus the J&J vaccine. But I think what prompted their decision now is that they have recorded in the United States at least 9 persons who have died in the first quarter of this year after receiving the J&J vaccine. And those persons had complications of thrombocytopenia, that's the clotting disorder, and because of that, it resulted in the death of these persons. Now, thrombocytopenia after the vaccine is a very, very rare thing. So it occurs, you have about 3.25 cases per every million doses administered. So it's very rare. Nevertheless, the FDA in the United States have decided to take these precautions because they have other vaccines that are available, namely the Pfizer mRNA vaccine and the Moderna vaccine. So that's why they have changed their recommendations. Persons who have received Johnson & Johnson vaccines, they don't have to panic, because if you have received the vaccine and you had no complications, then you wouldn't have any complications now. Generally, after vaccination, you would see thrombocytopenia developing about a week, 2 weeks after the vaccination. So if you've had the vaccine and nothing happened, then you're not in danger. So we've had 7 new cases over the last 24 hours, and we currently have 107 active cases, with 2 of those cases, 2 of those persons in the hospital. So in terms of vaccination, again, we haven't seen major uptake with our vaccines. So right now for adults, first dose, it's 440,628 doses. That's 85.9% of the adult population. Second dose, we are now at 339,960 doses. That's 66.3% of the adult population. Adolescents, or 12 to 17 age group, first dose is 34,570, or 47.4% of that age cohort. And second dose is 25,301, or 34.7% of that age cohort. Booster doses, we are still at 62,894 doses.
You have been watching the COVID-19 update for today, May 6, 2022. I am Shania Gonzalez. For more information, you can visit the Ministry of Health's website at health.gov.gy, DPI's website, dpi.gov.gy, and our social media platforms. Goodbye.